Dr. Frieda, I would like to ask you when you compare Indian medical facilities to that of European medical facilities, because you have seen them with very close eyes, right? So, what would you say to the people watching all around the globe? How do you think that the medical facilities here are in India?
First of all,
Mhm.
the differences are not significant.
Okay.
The medicine being practiced here is the same medicine being practiced in Europe or in the US.
Mhm.
That's number one.
Okay.
Secondly, it depends a lot who's practicing.
Right.
If you're being treated by a top physician or surgeon, you're very lucky no matter where in the world you are.
Right.
And if you're not, you're very unlucky also no matter where you are.
Right.
So those are the two things I would focus on. The third thing, there is, in comparisons to the clinics in, say, Germany, which I'm familiar with, and also in the States, one big difference that occurs to me here is there's considerably more staff
Right.
on hand than in the clinics in Germany.
Right.
I hear the nurses here speaking with each other, joking sometimes, laughing. You will never hear that on a German hospital floor.
Right.
People are so stressed
Right.
and they're so overloaded with work.
Mm-hmm.
They don't have time to laugh about anything.
Right.
And when they go home, they lay in bed and sleep
Okay.
because they're wiped out.
Right.
So that's the second difference. And that reflects itself when you're a patient. Just after surgery, you're really stuck in your bed.
Right.
You're not walking around like I am now,
Right.
or was before
Mhm.
surgery. It's a different situation.
Right.
And when people who are in a good mood
Mm-hmm.
come into your room
Mm-hmm.
and sort of light up the room with their own happiness,
Right. It spreads positivity, right?
it's absolutely contagious.
Right.
And it really boosts my spirits.
Right.
So that's a second difference I've seen.
Right.
There are differences also, of course, in the amount of money
Mm-hmm.
that's been invested in hospitals.
Right.
German hospitals are subsidized.
Right.
So the state is actually paying a lot of the costs for everything, for
Right.
equipment,
Right.
for the beds, for the facility itself, the building.
Mm-hmm.
Most of these things have been completely subsidized.
Right.
And there's more money circulating in Western Europe for these purposes than there is in India. But I don't see it making a difference in the treatment of the patients,
Right.
for one thing. And secondly, because of the way the staffing is, it's actually probably the other way around. Probably the treatment and the chances for good outcomes are better here than for a similar situation in Germany. That may seem strange to think about, but the reason is that staff here is paying attention to what's going on, and they're not forced to go in for a minute and go out and not know what's happening with you. And the second thing is, if you have a surgeon in charge, like Dr. Kaushik here at Olmec, you're just very privileged and lucky to be a patient here.
Right.
I would not want to be at any other clinic, anywhere else. Not in Europe, not in the US, not any country, certainly not Thailand. This is the only place I would go myself. So if you're asking, what do I think? I would suggest people should think about contacting Dr. Kaushik and see if they can work with him for an appointment and see if they can come here. I think the demand is probably going to be large. Probably more people would like to come here than he can handle.
Right.
But it's worth a try.
Right.
And I have to say, my situation in March, before I came here, was not good. I had suffered a prolapse of the neovagina, which is a very unpleasant complication. And on top of another complication that happened earlier. And really, it was just the prospect even of being able to come here that kept me going. And I'm glad it did, because Dr. Kaushik really was able to help. And that's a rare skill. And I would say, not just a skill, it's like a gift that he has to be able to do this.
Right.
So I can't think of a better place to go.
Thank you so much. Thank you so much for the kind words, Dr. Frieda.
One other thing I would add, when you go, think about bringing along a chaperone.
Right.
A chaperone is always good.
Mm-hmm.
I know some clinics I've seen demand that you bring a chaperone with you.
Right.
Because they know that helps in the care directly after surgery, especially then.
Right.
And I think that's a sound concept.
Right.
I was lucky to found in Germany a German chaperone and Lebenscoach, as she calls herself, Mona Meyer, with Maiar to spell it,
Right.
who was my chaperone here at Olmec.
Right.
And fortunately, she knows from previous clients she's had, both Dr. Kaushik and Dr. Sananda.
Right.
And actually, I think Mona was instrumental in having me accepted here.
Right.
Because, as you mentioned at the start of our first interview,
Right.
I fall outside the normal parameters for patients for SRS or for especially major surgery due to age, 79. On the other hand, I'm in pretty good health and have worked hard to stay in good health over the years.
Right.
So if they didn't make a bet on me, I think that bet has paid off.
Right.
For me, it certainly has, and I hope for them too, that they recognize that sometimes even going way outside the norm can work.
Right, absolutely.
Yeah.
And by the way, for those who don't know, Mona Meyer has also been one of our patients at Olmec, and now she has turned into a coach for trans people. And we have also done an interview with her, and we are gonna release it very soon as well.
Great.
So, as you said that you're 79, but you're healthy, you're perfectly all right. So, obviously, I would like to ask this question. You're 79 and still so healthy and perfectly fine. What is the reason behind that? What are you taking? What diet are you taking? Or what things are you doing that keeps you so fit? For those who might be willing to go for such transitions, it would be great for them to know how they can keep their body fit for these kind of transitions.
Sure.
Yeah.
First of all, there's some things I don't do.
Right.
I don't do drugs.
Mm-hmm.
I drink almost no alcohol.
Okay.
I might drink half a glass of wine in a month, if at all.
Okay.
I try and get enough sleep.
Mm-hmm.
For me, that's about 6 or 7 hours.
Okay.
That's enough.
Right.
And my diet is important to me. I eat mostly vegetarian.
Right.
I eat maybe 6 or 7 fruits,
Wow.
whole, mornings with
Wow.
some yogurt and some oatmeal.
Right.
And eat that slowly across the morning, not all at once.
Mm-hmm.
I don't wolf it down,
Right.
but eat it slowly.
Right.
And I don't eat a large lunch.
Right.
And at dinner around 7 p.m., I will usually have a large mixed salad.
Okay.
My wife and I cut about 7 or 8 different vegetables
Wow.
up. We put them in a bowl and mix them.
Right.
And I try and get enough exercise about usually every day for about an hour.
Wow.
Walking. I have these sticks like skiers use to go walking with.
Wow.
In Germany, that's called Nordic walking.
Okay, so Dr. Freda, I would I even played this little game, I would say, with Mona as well. I would like to do this with you as well. So what I'll do is I'll come up with a phrase or a couple of words or a single word. It can be a name, it can be anything, right? And you have to reply to that answer to the question in one word or a couple of words. That's it. Okay, and it has to be quick as well, right? So it has to be rapid, right?
Let's try.
Rapid fire, right?
Let's try.
Okay, so I'll start off with Dr. Kaushik.
Great surgeon.
Perfect.
And a wonderful person.
Wow, perfect. India.
I really enjoy my time here.
Perfect.
And I'd like to return.
Perfect. We would like to host you again. Okay. Olmec.
Olmec is the best place I could have come to.
Perfect. Transgender community.
Transgender community I belong to.
Right.
I'm proud of.
Right.
And I hope we keep making progress.
Okay.
Yes.
Nice. Okay. One person who you look up to always.
I always look up to my parents.
Okay.
Even though we didn't agree on everything, including on my transgender nature.
Right.
But still, that's always been important to me.
Okay.
And I look up to colleagues who are better than I am.
Okay.
And that's one reason why I look up to Dr. Kaushik.
Okay. Okay. When was the first time when you realized that, okay, there's something different going on with me? What was that age, and who was that first person to who you confessed to that, okay, there's something different going on with me, and I feel that there's something different? When you realize that, okay, might be that I'm a trans or what?
Around 6 years
Okay.
of age.
Okay.
Maybe 7.
Okay.
Of course, I didn't know what it was.
Right.
I just knew I was different.
Right.
And that stayed that way all through school.
Okay.
High school. And in adult life, I've sort of pushed that back and aside.
Okay.
And I have to say, unfortunately, my parents also forced me to do that.
Okay.
So I didn't have too much choice. And finally, I think COVID actually created a situation where I started to rethink my own position to myself because of the acute threat from COVID.
Right.
And I was thinking, well, this could get you.
Right.
Is this the way you want to exit
Right.
the world?
Right.
And I said, no, it's not. That's not who I am.
Right.
I need to change.
Right.
And that's when I started working on changing and accepting my transgenderism and taking steps to make a transition, including surgical steps.
Perfect. Perfect.
Yeah.
Okay. Very nice now. Okay. So, Dr. Freya, I would like to ask you one last question. I won't bother you much after this. So, you have had your last surgery now.
Yes.
At Olmec. How would you like to conclude this interview, summing up the whole journey at Olmec, from coming here to India, to meeting Dr. Kaushik, to having the staff being there for you, and everything that has been a part of this whole journey at Olmec?
Yeah.
How has it been, if you sum it up?
Actually, the first visit to Olmec was in my mind. I think I mentioned earlier, I'd actually had a dream.
Right, you did.
Dr. Kaushik was operating on me, and I woke up
Right.
and was completely at peace
Right.
and calm.
Right.
This was not a bad dream. It was
Right.
a good one.
Right.
And since then, I think that's been confirmed
Right.
through my experience here.
Right.
I've been met incredibly wonderful people. Everyone on the floor is just such beautiful people.
Right.
The nurses, the housekeeping, cleaning, the doctors who come in over the weekends and nights
Right.
are just all there for you.
Right.
And I just feel very safe in good hands. And the other thing is, I am in good hands of Dr. Kaushik. So I'm extremely lucky, and I feel very privileged to be able to even be here. And I would like to, at the end of this interview, just say thank you to everybody, cleaning staff, housekeeping, nursing, the doctors, and of course, Dr. Kaushik and Mrs. Dr. Sananda, who I think had a role in accepting me also. So I'm just very thankful to all of you for supporting me and helping me get back on my feet and return to a healthy state of physical being again. That means so much if you've lost it. And unfortunately, I had after these complications from Thailand.
Right.
So this is more than I could have hoped for.
Thank you so much, Dr. Frieda. Thank you so much for your kind words. It's even more touching when it comes from a very senior doctor herself. So thank you so much, Dr. Frieda, and it's been an amazing journey.
Yes.
It's been a privilege for us as well to be a part of this transition journey of yours. So thank you so much, and we wish you all the best, and we wish you uh, the best for future, all the best for future in Germany and your journey ahead. Thank you so much.
Thank you very much.
Thank you so
I
much.
appreciate that.
Thank you.